Well, thank you very much for inviting me this evening. I always enjoy talking to groups, and I'm very interested in your organization. As you'll hear, and perhaps some of you know my story already, transparency is a really important issue close to my heart, and also healthcare quality, obviously, and affordability. All of it is important. Let me tell you my story. It's a humble story, and one of 150,000 stories across the country of how healthcare, unsafe injection practices can compromise a patient's life. My husband and I have been here since 30 years this month. We're native Nebraskans. So the next slide, you'll see a picture of our family. This was 10 years ago when I was diagnosed with, right before I was diagnosed with breast cancer. Of course, it was concerning to us. I was 45 years old and we had 3 young sons. But we were assured by our local oncologist that it was be just a little bump in the road and that very soon I would be just back to life as it was before. So went through chemotherapy for 6 months. That all seemed to go fine. We were all very optimistic. However, I did have a recurrence of the breast cancer in about 6 months after I completed the first round. So at that time, we knew that this was not just a bump in the road, and indeed it took us in a direction for the rest of our lives in ways that we never could have foreseen. I consulted with the Mayo Clinic and the University of Nebraska Medical Center and decided to have a stem cell rescue. This was a very difficult, taxing, arduous procedure, and I knew it wasn't going to be easy, and it really took a lot of courage on my part, a lot of interior work to agree to go through this very difficult time. But I had a lot of motivation. I had 3 sons. Our youngest, Alex, was 14, and Curtis was 18, Luke was 20. I really wanted to see them grow up. I wanted to see them be the kind of upstanding man that their father is. So I would be an inpatient for 3 weeks, and most of that time in isolation and in the ICU. So when we arrived and we had our intake eval, the oncologist, the one at the medical center, came in and sat on the edge of the exam table and said, well, Evelyn, you've got hepatitis C, and given that backdrop, I'm not really sure that it's a good idea for you to have this stem cell rescue. You just got a lot of medical issues here that we really need to sort out first. Well, this was a bolt out of the blue for us. Tom and I were just dumbfounded. I had no risk factors at all for hepatitis C. I'd never had a blood transfusion. I'd never done illicit drugs. I'd never engaged in risky behaviors other than accessing medical care. So we were flabbergasted by this and just sort of hung our heads and went back home until I could have a liver biopsy so that the doctors could make further recommendations as to whether or not I should have a stem cell rescue. We were so stigmatized by that diagnosis of hepatitis C that we didn't tell anybody about this. We didn't tell our children or our parents or our siblings or our best friends. And in fact, I even asked my personal family physician to keep it out of my chart because he and my husband share the same medical office, and everybody who works in that office has access to that chart, and I just didn't want anyone to know about this. So ultimately, I did have a stem cell rescue. I did survive that. I did survive the cancer. So far, it's been 9 years since my last cancer bout, and we are profoundly grateful for that. So after the stem cell rescue, my husband returned to his practice on a full-time basis. He was off quite a bit to be with me. And he just was very troubled by this diagnosis, just kept turning it over in his head and just thinking about it and wondering about it and just feeling just very curious, very concerned about how this might have happened. So although we didn't tell anybody else, he did share with his nurse, Jean, and over in the course of the next month, they took great pains to really review every patient that crossed their threshold. And in doing so, they found elevated liver enzymes in a number of patients and tested those for hepatitis C and found 4 more patients with hepatitis C. The common factor, all of them being, they were all his parent patients, but they were patients at the oncology clinic. At about 7 weeks, a gastroenterologist from Omaha called Tom and said, I called the hospital to ask about this. I just wanted to see if they know anything. The gastroenterologist had 2 cases of hepatitis C, genotype 3A, which is a rare genotype. And they were cancer patients. He had heard that Tom had some patients as well. So between the 2 of them, they talked it over and decided that it was time to call in the health department. Nebraska Health and Human Services came out immediately. They also were accompanied by a epidemiology fellow from the CDC. They began a very thorough investigation. They decided that they needed to alert all patients within the past 2 years. They sent a letter to 650 Nebraskans saying, Dear Sir or Madam, you have potentially been exposed to hepatitis C, hepatitis B, and HIV. You need to go in and be tested for these diseases. It is possible that you were exposed. Please let us know what you find out. Of those 650 patients, 480 were actually tested. Of those 480 patients, 99 of us were diagnosed with hepatitis C genotype 3A, all the same strand. So it was a very large outbreak. We are the largest outbreak to date, all from one single source, one origin of the virus. So next slide. All of this is contained in a book that I wrote with Travis Bennington. Travis is a lawyer from Fremont who represented 20 of those patients in their malpractice suits. It's a real comprehensive look at an outbreak from the medical, legal, and patient perspective. It is one of those stories that I think fact is stranger than fiction. Next slide. How did this happen? What went wrong? How could this possibly happen? And let's go to the next slide. So what we know through the investigation that the Health and Human Services did was there was an improper port flush procedure. And that is when the nurse would draw blood from our ports. She would put that blood in lab collection vials. She would switch off the needle, but use that same syringe, that contaminated syringe, to access a 500 cc saline bag to draw off saline that she would then go back to our ports and flush our ports. There was only one nurse for most of this time at the oncology clinic. She was an RN. When she reused that syringe to access the saline bag, microscopic bits of blood was drawn into the saline bag and contaminated the saline bag. In the morning, the saline bag would be fresh, new. They would start with a new one and use that all day long. You can get about 50 port flushes from a bag. By afternoon, it was cloudy pink with bits of sediment. So that was our source of contamination. Okay, next bullet point. We know from the investigation that a person, I don't know if it was man or woman, came into the clinic with known hepatitis C in 2000. This person grew up on the East Coast and was a drug abuser. I'm going to use the pronoun he, but again, I don't know if it's a he or a she. So he was the person who brought the virus into the clinic, and his blood contaminated and introduced hepatitis C into that saline bag. So how so many people contracted this disease was he may have come, let's say that he came to the clinic on a Monday, and let's call him patient A, and his blood may have infected through that saline bag. Maybe patients B, C, and D contracted hepatitis C that day. And let's say the next week, patient B came on a Tuesday, and patient C came on a Wednesday, and patient D came on a Thursday. So, although it's the same virus, same genotype, that was how so many people were exposed. And such a large percentage of the exposed people did contract the disease. And we were all very immunocompromised. Not altogether surprising that so many of us contracted it. So the next bullet point, there were numerous complaints to the physician, both from staff members. There would be nurses that would come in to help out when they were very busy. If the nurse was gone or they needed extra help, there would be other staff nurses that would come in and help, and they would complain to him. Patients complained to him about the nursing procedure. There were complaints from pharmacy, from lab, nursing, and from patients. And these complaints continued for at least 16 months. That is the length of time that they determined from the time that the index case came in until the nurse was let go. But she was the only nurse at his beginning, so it probably went on 4 years, I believe. So that's what happened. Next slide. What happened to the victims? Dr. Malyard, University of Nebraska Medical Center, did a study on our cohort. We enrolled about 2/3 of us, which is a fairly high percentage. And he has followed us along. He's found that 6 of the 99 have died from hepatitis C, not from their cancer. So all of us went to the cancer clinic to be cured of one life-threatening disease, but we came away with a second life-threatening disease, which ultimately did claim the life of 6 of us, not the cancer. There was one liver transplant. He did die of liver cancer. We assured at the start of the litigation that there's basically no way that we could transmit this virus to our loved ones. However, there was one documented case of sexual transmission. 11 of those folks died of their cancer, including several who underwent treatment. The treatment is very rigorous. It's a combination of interferon and ribavirin. I've been through a lot of chemotherapy, but this was worse than any chemotherapy that I ever went through. So I find this a very sad, they're all sad statistics, but I think this one is very sad that several folks went through this horrific treatment and sacrificed a big part of their life when ultimately they died of their cancer. So that was for really no avail and took precious time from their lives, from the time they could have spent with their loved ones. There were 89 lawsuits. It's interesting that although there was 99 victims, and it was very clearly shown that there was clear cause of malpractice, 10% of us found him he was so gregarious and such an engaging person that 10 of us could not bring ourselves to sue him. So there were 89 lawsuits, 16 million of which was paid from the Nebraska Excess Liability Fund. Nebraska is a capped state, so the payments for 86 lawsuits came from the Nebraska Excess Liability Fund, a fund that all the physicians in the state pay into. 3 lawsuits were paid by his actual malpractice insurance company. Next slide. Although this is an incredible story, and one would like to believe that it was an isolated incident, happened once a long time ago, unfortunately that is not the case. It has happened before us. It continues to happen. Monthly, it seems, we get a report through the media about another situation. So let me tell you about the one in Las Vegas. That may be one that you are familiar with because it did gain quite a bit of notoriety. So next slide. What happens in Las Vegas? What happens in Vegas? In February of 2008, the State Health Department of Nevada sent a letter to 63,000 patients telling them that they had potentially been exposed to hepatitis B, hepatitis C, HIV through reuse of syringes at an endoscopy center. So they got the same sort of letter that I got and 650 Nebraskans got. We find that the folks at the CDC have been studying this and have been collecting statistics. In the past about 12 years, there have been 150,000 United States citizens who have received a letter like this from their state health department. And It is due to, in all these cases, reuse of syringes or other medical equipment intended for one-time use. So in our case, in Nevada's case, in all of these cases, typically what happens is that an injection or a blood drawn is given, the needle is switched off, but that same syringe is used to access, in our case, a large saline bag, but in the case of Las Vegas, a multi-dose vial of anesthetic for their endoscopy procedures. When that syringe accesses that multi-dose vial of propofol, the virus contaminants are drawn into that multi-dose vial, contaminating that vial. And then, when that vial is used for the next patient, and the next patient, and the next patient, the virus is transmitted from the contaminants in that vial to subsequent patients. So in Las Vegas, they found 9 definite cases that they could track through DNA, and then 106 that were possible cases that they couldn't think of another reason why they might have hepatitis C. There were no other risk factors. The cost of just the investigation, the response, and the testing was about $16 million to $21 million. So, what happens in Vegas, next slide, happens elsewhere. This is a map of other notification campaigns. Sometimes they're just a notification campaign, not just. It's a large-scale notification campaign where these kinds of letters are sent out. We are dependent, because of privacy issues, and we don't always know what happened to a campaign, so we may not know, it may not be reported in the media how many people did actually contract hepatitis C through a situation where they received a notification letter. So you can see there's many of them. They continue to happen. There have been a number of different kinds of settings ranging from hospitals, ambulatory surgical centers, pain clinics, residential settings like nursing homes and psychiatric residential settings. It's happened at health fairs, it's happened in private medical practices, and it has happened in holistic health centers. Next slide. So really, why does this happen? We know the nuts and bolts that nursing or physician personnel are reusing syringes to access multi-dose vials. But really, this is standard, isn't this standard training in medical school and nursing school? And I think the answer is yes. But things happen, even if in the best of training situations when professionals get out in the real world, perhaps they have been trained by a mentor, like our nurse said, that the doctor trained her to do it this way, and that's the way that she did it. Or perhaps they never got any training, especially in unregulated, audited settings like private physicians' offices and ambulatory surgical centers where there's not such a high degree of oversight like in hospitals. Patients to be seen, you've got 10 charts up. That's what the lingo is at my husband's office. We got 10 charts up, meaning there's 10 people waiting to be seen, so you got to move along quickly. And so then people tend to take shortcuts, and shortcuts don't always result in proper procedure. I think it's rare, but it is possible that there's a money pressure situation. Syringes and other kinds of disposable products intended for one-time use are very, very inexpensive. However, I guess it can be a thought in some people's mind that they don't want to waste, in quotes, that syringe. And they feel that they're safe because they've changed off the needle. So they really aren't thinking through the whole situation, and these kinds of constraints do not result in thoughtful practice. People aren't really thinking it through step by step what all this means. Next slide. When Tom and I realized that I was a victim of malpractice and that potentially we could gain a monetary award from this, we determined that we wanted to do something good. If we ever got any money, we wanted to do something good with this. We didn't know what that something good was, but the universe has a way of guiding our footsteps. And with our malpractice award, we started 2 organizations. Honor Reform is a 501c4, which is an advocacy for policy and regulatory options. Our foundation is an educational foundation where we educate providers and patients about safe injection practices. So next slide, please. One of the alliances that we've been privileged to join is the Alliance for Injection Safety. We have partnered with the American Association of Nurse Anesthetists, Hospira, and Becton Dickinson, and this is our policy work. We are in the process of scheduling a congressional briefing to educate our members on Capitol Hill about these outbreaks. We've been fortunate to secure funding through the budget for fiscal year 09 and fiscal year 10, about $2.5 million each of those 2 years that went to the CDC to fund the One and Only campaign. And I'll tell you about that in just a minute. We haven't heard about fiscal year 2011. We'll see. We know that the budget is very tight this year. We also collaborate with the FDA and CMS, company services, and the CDC on policy issues and providing comments about policy. So next slide, One and Only campaign is basically, the gist of it is one needle, one syringe, and only one time. We have a patient empowerment arm and also a provider education arm. Next slide, we developed campaign materials, some specifically for healthcare providers, to help them remember it is never appropriate to reuse syringes or other medical devices intended for one-time use. There is a training module that is on the web. It is a free CEU that specifically addresses safe injection practices. For patients, we also have brochures for them and encourage them to ask questions of their providers, which we know can be rather intimidating to speak up and talk to your healthcare provider and asking these kinds of questions. So we're giving them as much encouragement and as many tools as we can to help them feel comfortable and help them feel empowered that they are partners with their healthcare provider to make sure that everything is safe, everything that the provider does and is in partnership with the patient so that healthcare is as safe as it possibly can be. So we encourage them to ask, is there going to be a new needle, a new syringe, and a new vial for this procedure or injection? Can you tell me what you do to stop the spread of infections and what steps are you taking to keep it safe? Next slide. The One and Only campaign, we have a very robust website that provides just lots of information at every turn about safe injection practices. It gives references to policy developed by the CDC and guidelines developed by the CDC. It has lots of resources. It has all of the campaign materials for both patients and providers. There's an Hippocrates app that providers can access through their mobile cell phones to give them information and another way of education for providers. We have developed a training video, and have gotten about 5,000 requests across the globe for this video that is specifically intended for providers. And can't see the last one, but we have now been funded in 3 states, Nevada, New York, and New Jersey. Through their leadership, we are able to get the word out to anybody across the country through accessing the website. So again, for patients, we encourage them to bring an advocate when they access healthcare. That's the next slide. And then the next slide talks a little bit about the Honor Reform Compassionate Response Toolkit. I found that when I was diagnosed with hepatitis C, I just had to make a lot of decisions about my healthcare, about my financial situation, about my legal situation, and about how I was going to gather support and how I was going to work through the stigma. That was just a huge issue for me for, unfortunately, a whole year. I didn't tell anybody about it for a whole year. We've come to realize that people need lots of information when they get a diagnosis of hepatitis C, especially when it comes through health care. That's how they contracted that disease. So using my experience, we partnered with the Creighton University School of Nursing, and they put together this Compassionate Response Toolkit. It's a compendium of resources that I think will help many people who've been just recently diagnosed, and that is also available through our website. So, next slide, conclusion. Unfortunately, these outbreaks continue to happen and continue to affect many people across the country, but there are ways that we can prevent them, and we really encourage you all to join with us to look for safe injection practices. Perhaps you can give us your email address, and from time to time we'll send you an email asking you to contact your congressman on a particular issue. Please spread the word and be an empowered patient yourself when you go to your healthcare provider to make sure that you ask the right questions. Is this one needle, one syringe, and only one time?